Let's begin tonight with nurses. This breaking news. District health boards have late this afternoon released details of their revised offer to nurses. This comes after thousands of nurses walked off the job for the first time in 30 years earlier this month. The new offer includes fast-tracking one of the salary steps for registered nurses and midwives and the $38 million commitment to increasing staffing levels immediately. Joining us now is DHB spokesperson Jim Green. Jim, are you there?
Yes, I am, John.
Nice to talk to you. Thanks for joining us. We really appreciate it. I'm just trying to work out what's different here. I'm looking at the statement put out by the DHBs. We were pushed hard by the union to put together a package that met their members' demands for action on safe staffing. How have you done that?
Well, we've improved the offer in two ways, John. One is around that safe staffing area. One of the things that NZNO was really clear about for their members was wanting to make sure that those new staff are going to get there into the wards and make a difference. And they wanted to have really regular and concise and clear reporting to their members in the hospitals that what was happening, where are the vacancies, how are they being filled, that sort of information. They wanted that really up front. And so we've added that in, some really strong words around that so that people will know where they're at.
Right, strong words. Sorry, forgive me for interrupting. Strong words. Will there be more nurses, more money for new nurses?
Well, this is the commitment that the government's already made, and that was money that was in the last offer. But it was this part of it was really wanting to make sure that we've got the mechanisms there so that everybody's clear about what's happening and that those people are getting to the front line where they're needed.
Okay, I can see why they. But were you in negotiations, Jim? I can see why they put you in there. Is there is there new money? Is there more money?
Well, there is the change in the step, the RN7. So that was the other part that's really changed here was that the nurses wanted to make sure that that new top step was included within the term of the agreement. So that has been brought forward to go in there.
Okay, but in terms of the overall cost of this package, has there been an increase in the fiscal value of this package compared to the last proposal that went to nurses and was rejected? Is more money being spent? I know it's being spent earlier and slightly differently, but has there been an increase in the money spent?
Well, that's you've summed it up very well there around the earlier, bringing it in earlier, and it's been the government's made it really clear that there is no more money from them in terms of supporting this, and so we're going to be talking with the Ministry of Health about how we can work this through. But to us, it was really important to move forward on that. We're keen to get moving, and so are NZNO and its members. And so we wanted to get resolution so we can move forward quickly. Now.
And the minister calls this encouraging. Were you stuck between a rock and a hard place here? So what you've said is there is no new money. There's no extra money. Sorry, there was new money, but there is no extra money since the last offer. So you have the minister saying, nah, you've hit the ceiling. There is a cap on this deal, and you have reached it. You have the nurses saying we want more and we want it meaningfully spent on increasing nurse numbers. Were you stuck between a rock and a hard place? How have you achieved a new offer which will be meaningful to nurses?
Well, I think that's because we've listened to the NZNO's bargaining team around the really key things. They've spent time since the last offer was rejected, going back to their members and really hearing again what are the important things. And that team has done a really good job in working with us and understanding what the main points are for their members. Okay. And, the nurses are really interested in two things, we think, and it's what's come out in the settlement. They're interested in better staffing and really making a difference for patients. That's what people get into nursing for. And so this has been a very strong part of the whole campaign that the nurses have made around this. So we've responded to that, and we've not only responded to that, and the government has as well by putting more money into the pot for that, but we've also responded to it and actually making sure that this actually now translates into those changes that the nurses want for the patients and for themselves. So that was one of the really important things. And the other one was around, that salary step to get that within the term.
Jim, we've received a lot of feedback immediately on Facebook, and I guess people need to study the offer, and it's been put to them by the NZ Nurses Organisation, as you say. But we've instantly heard from some nurses. Now, producer Michelle Cook spoke to a nurse just a few minutes ago. She said she was pleased to see a date for pay equity, but felt the shortage of nurses hadn't sufficiently been addressed. This is what she said.
This new offer is pretty much just a reshuffle of previous offers. They seem to be taking stuff away and then bringing stuff back to try and make it look different. Safe staffing is a really big issue that needs to be addressed now, and it can't wait until a later date, and 500 nurses is not going to cut the mustard. And I think that fair pay needs to be looked at now also.
So 500 doesn't change, but you are saying that people will see new nurses sooner.
Yes, absolutely.
What do you say to that nurse? Yeah, please respond.
Well, I can respond very well to her and say, this is at the heart of what's actually been agreed with her bargaining team over the last couple of days, to really beef up our response as quickly as possible to these issues, to get those nurses out there, and to have a salary structure that is promotes nursing as a career for people, so retains people within it. So I think that we've done a lot, and herself and her colleagues have really pushed and made sure that their voices are heard, and we've responded to that. So I hope now that nurses will be able to see the progress, get all of the details from their union, and support us now and moving forward.
Jim Green, we really appreciate you fronting at very short notice. Thank you. Jim Green, who is the DHB spokesperson.